like your testosterone's low, that's a big deal. As we go through menopause and then we go through male menopause, which is not such a thing, but like when we go through those 30s and 40s, those are the main hormones that like really drop off. Exosomes can actually go places that the stem cells can't because the stem cells are too big. When the exosomes go to that place, then they can generate and make more stem cells.
Welcome back to What Can We Get Into? This week we got a spectacular guest. If you've been wondering about stem cells, PRP, peptides, regenerative medicine, this week's guest is for you. This is Glenn Cochrane. I've known him about 18 months.
Yeah.
Glenn, tell us about yourself, sir.
Hey, thanks for having me on. This is great.
Of course, man.
An opportunity. So, and thank you for being my doctor too, by the way.
Of course.
Just to mention that, throw that in there.
Of course,
you've been seeing me for over a year.
Yeah, it's been good. Hopefully you've had a good experience.
It's been a very good experience.
I love it,
absolutely.
Man.
So,
well, welcome. Tell us a little bit about your background. I know, we actually, fun fact, we tried to, we did shoot a episode 1 that never made the light of day. It was before I had all this equipment and everything, and I just wasn't happy with it. I shot Glenn a text. I'm like, Glenn, let's redo this, man. I've upped the game a little bit. Let's give the people what they need.
Yeah, I didn't like the way the light looked on my hair.
Yeah, I know, man. We had to redo it.
So I own Infinity Functional Performance. So we're out of Dallas, self-made training facility. We have a couple of other locations as well. We do in-person and telemedicine all over the United States. I call us like a human performance company, but basically we do everything from functional medicine to hormones, peptides. We do a lot of work with personal trainers. Recently we've brought on metabolic testing as a cornerstone of our client assessment with VO2 max testing and all sorts of that kind of good stuff. We do gut health, you name it. But
so you've left traditional medicine, as we call it.
Yeah, somewhat, a little bit. Yeah.
Why did you leave the old pilfer and ill mentality?
Yeah, so I started in the medical field pretty young on. I was about 16 years old. I started getting interested and wanted to be a firefighter, and went through some stuff in high school and became a volunteer firefighter. Got my EMT. Was a paramedic at 19. This is all in California, and so I was a paramedic at 19. As a paid call firefighter, and for personal reasons, I just decided that I had some life events happen that decided to put me in where I'm at today, and so I continued on. I got a degree in nursing and did just about everything you can imagine there. So all the way from neonatal, pediatric, adult, ER, ICU. I've flown helicopters for a number of years, and then.
You got the bio for sure. You got the You got the
and so through that journey, I've always been sort of into sports. I was a lifelong athlete. I'm not going to say I was like really great at everything, but I was a baseball player, wrestled, things like that, and I really enjoyed weight training. Through my earlier 20s, I just was really got interested in the whole. Functional approach to managing your health, from the foods we eat to exercise, learning about some of the nuances to, why do people develop chronic disease, and is there a different way to treat it? So eventually I went back to anesthesia school and became a nurse anesthetist, continued on, got more school, functional medicine, pharmacology, toxicology, and ended up, deciding to open these clinics. So
you're telling me there's a better way than just prescribing somebody a pharmaceutical for chronic illness?
That's weird, isn't it?
It's revolutionary.
It's totally a strange thought process. Yeah. So
obviously all the stuff that you're doing, we're talking about Peter Attia, how he's on 60 Minutes, and how this is like finally starting to break away. What are you seeing within, pop culture? Is it getting more popular? Are people starting to open their eyes to this type of stuff?
I think it is. I think that, I hate to say it's like a new approach. It's not necessarily a new approach to health. I think functional medicine's been around for a long time. When we talk about functional medicine, we want to phrase that more in a root cause approach. And it's not that traditional medicine doesn't really have that goal in mind. I think they kind of ideally would like to have that, but I think that just a lot of the training that maybe evolves.
Well, it's hard when their mentality is you have X symptom, prescribe X treatment.
Yeah.
They're never really going to look backwards at how they got there. They're just trained to treat with the symptoms. I mean, it's the training. It's not a flaw. It's just training.
It's the training, and it's just I think that we've been in a lot of functional medicine providers. They're traditional providers in medicine. It's not like I don't know real medicine. It doesn't mean I don't practice, taking care of people. It's not like, can't get vaccines, can't take antibiotics or blood pressure medicine if you have those issues. But more is like, well, what is causing it versus, hey, this is the problem. Just give the medicine for that. Yeah. I only have 5 minutes with you today, and you're going to be on this medicine the rest of your life, and that's what it is.
What's the number one thing that people come to you with to fix?
Man, I think it's a variety of things. I think what they come to me to fix most of the time is unsolved problems. They've been treated for something for a decade, 2 decades, and they just don't find answers. They don't see resolution. They get stuck in the system. It's the same thing. I've had acid reflux for 20 years, and Pepsid is not cutting it, or I've had high blood pressure. I just can't seem to get over my weight issue or whatever. And they've tried a million things in traditional medicine, and they're just not satisfied with being listened to. They're not satisfied with the answers they're given. They want to do more than just, take a medication or be like, hey, this is just the way it's going to be.
So the hard part about your job is you got to know a lot about a lot.
Yeah.
Because people are coming to you with a lot of different things. We live in a world where medicine is so hyper-specialized, which I think is a great thing if you've got a very weird, random diagnosis in an organ system that's isolated. But if you've got a GI issue because of systemic inflammation that's not showing up maybe necessarily on any GI testing, it can leave patients scratching their head. It can leave doctors scratching their head. There's nothing wrong with you, et cetera. How much do you think that hyper-specialization of medicine has gotten us to this point?
Yeah, I think part of the problem is people don't talk to each other, for one. So I think that specialists are extremely important, and I think the biggest part to being a really good, excellent provider in anything that you do is knowing when to ask for help.
Right. And,
hey, this is not my wheelhouse kind of thing. What I enjoy doing the most is being able to quarterback those situations and be able to look at the picture and multitude. And it's funny because anesthesia is kind of that way too. And I've just always been sort of drawn to that, I started my career as a paramedic. And you don't know a lot about everything, but you know a little about everything.
Right.
And then once you become the anesthesia provider for the hospital, you're like the resident pharmacologist, pulmonologist, cardiologist, interventionalist, proceduralist, ER doc. You don't know as like a specialist, but you know a lot about all of it.
Yeah.
And you sort of got to have a big picture of that. And so functional medicine, that's what I love about it, is because it's like, you get a really good grasp on a lot of the different systems, whether it's hormones, GI, detox, immunology, pharmacology, and being able to put it together and see how those different pieces of the picture work together.
Yeah.
And be able to sort of develop a definitive plan and, and make one that is actually adherable and sustainable more than, I'm going to do this for a month or two. This is exhausting and I'm done. So from a client perspective.
Yeah.
That's the thing. And so that's, going down that whole rabbit hole for like functional medicine too. One of the biggest problems you hear is you hear somebody go to functional medicine. Like, oh, I've talked to a functional medicine provider before. And I went and I had to empty out my whole kitchen and I had to get all this food for 2 months and do all this money testing. And after a month or two, they're like, give me a break. Like, who wants to live this way? Yeah. And it's not sustainable. So you got to be able to build a plan that somebody could stick to.
So is your step one testing? Like that's step one, right?
Yeah. Step one is identifying the client needs.
Okay.
Even before that.
Right.
And so, testing would be a great diagnostic, but you also got to diagnose how committed are they to the plan? How bad do they really want to fix everything? What kind of investment are they willing to take? What is their, what part can we get them to stick on it, at least a little piece to at least get a taste of something? And then what can we do to fix that part?
So you got to have somebody that's serious, because obviously what you're doing, most of it's not covered by insurance, if any of it.
All right.
And it's a significant investment, and it's an investment. I mean, I don't think you look at it as a sheer straight up just cost. It's not like you're going to, go get filler or Botox where it's.
I could argue that it's a financial savings.
It is
in any stretch of
Long-term.
the imagination.
For sure.
Yeah, in every stretch of the imagination. But it is definitely a commitment, and we call it partnering with our clients more than anything.
Yeah.
It's just like, I'm not the dictator. I'm not the person like that. But let's find a plan that we can both agree on, that we could both work to, that we could stick to. And sometimes it's just a small piece.
Right.
And then after a while, they're like, hey, this worked. And then now they get trust, they get confidence, and then they can maybe we'll add this on. Now let's work on this other piece.
So you get pre-testing, come up with a treatment plan.
Yep.
Do you do post-testing or testing along the way intervally, or how does that work?
Yeah, so the testing, what would the testing be? A lot of it's going to start with lab work, client assessment, history, physical, and then lab work is a great foundational, especially if somebody hasn't had lab work out of the gate or for a long time, or even sufficient diagnostic lab work.
Sure.
A lot of times, insurance has a big control mechanism over what's reimbursed, what kind of coding, is done for certain tests. So a lot of the tests that we do may not even be covered under insurance, even if we took insurance. So getting a good client assessment lab work is a great foundation. And metabolic testing is honestly one of the big ones that we're doing too. So VO2 max testing, where the clients come in and they'll wear that mask and run on a treadmill, or if they're unable, they can walk on a treadmill or ride a bike or whatever. And we'll actually determine what the basic, what a VO2 max is, which is the body's ability to utilize a certain amount of oxygen per kilogram of body weight per minute. And
what's your VO2 max, Glenn?
what's my VO2 max? My VO2 max
Putting you on the
is
spot.
57.
57?
Yeah, 57.
That's
I was
fantastic,
surprised,
man.
yes.
That's great.
Yeah, so my VO2 max is 57. I just tested it 2 weeks ago.
Wow.
With our new equipment, yep. And
spectacular.
Believe it or not, my biological age was 33. I was really excited about that. So,
If this is not a...
because I'm 75. I was no, I'm 46, but yeah, so the testing does give a VO2 max, about 21 other really good biomarkers.
You getting telomere length or no?
Not telomere length, yeah. So.
Because everybody talks about telomere length for biological age. So how are you coming up with biological age on?
Yeah, so biological age, it comes with a variety of different factors. And so the VO2 max is one part of it, but heart rate variability,
I like that.
mobility actually. And so it actually determines how effective your breathing is, how effective your motion is, your ability to recover from a max heart rate also.
Sure, that's important.
So you could crank your heart rate up, but how long does it take you to recover back to a baseline heart rate? And so there's about 21 different markers that really sort of go into this complex calculation that comes out.
57 though, man. I'm happy for you. Do you do a lot of cardio?
I actually don't.
You don't?
Yeah, I
Do you know what
don't.
Lance Armstrong's is?
Man, I think it was, I don't know now currently, but I think the estimates for his were in the low 80s.
So I heard 94.
Really? Okay. Yeah, I'm sure there's variants.
When I was in college, people said that his was 94. It was like one of the, not highest recorded, but obviously you talk about a high cardiovascular endurance athlete, his ability to take oxygen and turn it into energy is pretty good.
Yeah.
Mine,
I might be able to get mine up a little higher if I took a little EPO too, though. So, but I mean, he was a really good athlete.
Yeah.
As well.
Yeah, man. Only one testicle though. So I think you got
I'm
him there.
teasing. No, but I mean, a phenomenal athlete. I mean, honestly,
Yeah, it's
and some
incredible.
of these are elite level. We had a guy at the gym recently. He's a high level high rocks competitor, and he tested in the high 60s, and it's just.
Now I feel defeated here. I did this when I was 22, my senior year of college.
Okay.
And I think I had a 53 or 54, like low 50s.
It's still exceptional.
Yeah. I was happy at the time, but I was also in the best shape of my life.
Yeah. Training
every day of the week, like, you're $1 million at 22. But.
Yeah. But, I mean, I think there's a lot of variables that come into like what actually a VO2 max is calculated on. So you don't have to do a whole lot of cardio actually to get that
Really?
up. Yeah. So you can even vary the way you train weight training as a result of that. And so you could actually do heart rate monitoring and really determine your rest intervals in between that and build a cardio. My best cardio I ever had was actually doing very little cardio as far as like you think running, but it was actually how I trained my resting periods during my weight training sets.
Is it more like a HIIT style workout where you're giving yourself rest, or do you want to go up and down?
You want to go up and down between the different zones. You want to be able to reset down into zone 2. And zone 2 is like, we should, one of the big factors that comes up with is your actual zone 2 gives you all 5 of your zones for heart rate training. We've heard like what zone 1, 2, 3, 4, 5, and what your max heart rate is. Now there's calculations, there's watches that you can wear that kind of give good estimates as far as like your VO2 max. There's calculations for like what your max heart rate should be. For example, like 220 minus your age is a great rule of thumb, or Correct. 208 times 0.7 will give you a little bit more accurate of like what your max heart rate should be. But take your max, take your age and somebody else, like that's apples to oranges.
What's interesting is I actually have tracked this over the years, and it's the 220 minus age has worked almost with years of a couple VO2 max and things like that. Mine has pretty good with 220 minus age, which is.
Have you ever been out of shape though? Like really extremely out of shape?
No.
Yeah. So you take somebody your age, slap on 70 pounds, make them a diabetic, have a high heart rate, they're like a metabolic syndrome. It's not going to take the same heart rate.
Yeah, so they'll
so it's going to be different. So they should be doing their training a little bit different as well.
Right.
And so their max heart rate or their zone 2 training, which would be like fast-paced walk, but you can still hold on a conversation with somebody. They're going to have a different zone 2 than somebody else.
Interesting.
So it's funny. We were actually doing metabolic testing on somebody the other day. I was training the trainer on how to do the metabolic testing, and we had 2 of his clients. And as we were going through, we were seeing where the body turned from aerobic to anaerobic, where he started burning, instead of burning fat, started burning carbs, and where the peak, we could actually see where he was going in and out of zone 2 into zone 3. And I was just like, isn't this awesome? I said, because where do you normally have him train zone 2? He's like, yeah, exactly. About 30 beats a minute higher than this. I said, exactly. So you've been having him train to burn fat at a level that he's actually been burning muscle based off the calculation. And it's no fault of his own, but this is the difference between like real testing versus just calculations.
So with this, with what you're saying, something like Orange Theory, which is literally branded off of being in the orange, which is zone 4, correct? Are you saying that for the mass population, that could potentially be detrimental?
In a sense, and it depends on the goals too. I mean, you could be training like that, and it will build your good cardiac endurance, but it's not necessarily going to put you in a fat burn zone. You're going to have the calories in the proper ratio to be able to support that. You're going to have the appropriate amount of recovery in between. But if you just take everybody and send them there, those people get stuck on their weight loss journey all the time.
How much do you think cortisol and that type of working out is related to weight loss and people achieving goals in terms of physique and weight loss?
Oh, it's tremendous.
Okay.
Yeah. Yeah, because there's so many variables with that. Time of day that you work out, different hormonal levels, how you get your sun in the morning, how do you go to bed at night, sleep hygiene. Those are all things that are thought of, And
what always intrigued me is going to a CrossFit gym. And, there's 2 rules of thumb on this. And I kind of this CrossFit can be great, but you also walk around a CrossFit gym. First off, you see a lot of broken people.
They're great for business, aren't they?
As a chiropractor,
they're great for business. I have some elite athlete friends who do CrossFit.
So right,
I'm like, thanks for your business.
But if you take someone, if you took a cross section of a CrossFit gym and the athletes in there, you got a decent amount of guys that have a lot of belly fat. They don't look like they do CrossFit 5 to 7 days a week.
Yeah.
And to me, it's not like you're not working out hard.
No, for sure.
I mean, you can't get in a CrossFit gym and dog it for the most part. I mean, I've been in gyms where you probably could get away in the corner, but the high intensity is like, it swallows you there.
Yeah.
So the further I got into that, I was like, at what point is this training a higher stress level and maybe being a detriment to you getting rid of that abdominal fat, man boobs, things like that? Like, it really struck me. What's your opinion on this?
Yeah. So, I mean, I think people get confused what training does half the time.
Yeah.
People think they're going in there to get in shape, but the time in between is the time that we need to recover and how we recover.
Sure.
So when you go into the gym, what are you really trying to accomplish? You're trying to hurt your muscles. You're trying to break them down so that they adapt and they grow back stronger. So if you don't get the proper rest, if your hormones are off, your testosterone's in the trash, your growth hormone's down, your thyroid isn't good, your cortisol levels are off in your sleep, that time in between is as important, if not more important, for the recovery.
Right.
And so if you're not able to recover and convert that, and you're just literally continuously breaking down muscle, utilizing, your food as fuel instead of burning fat, and then your muscles aren't growing back stronger because you're not giving it enough time, or you just don't have the hormones to be able to do that, then you're not going to see those results.
You mentioned something earlier which kind of struck me. You mentioned time of day. Is there a perfect time of day to work out? And I realize that expectation is probably different on if you're trying to be Lance Armstrong versus if you're trying to lose 80 pounds. What are you seeing in terms of recommendations for time of day to work out?
Yeah, so I'm not a big fan of working out at night, to be honest with you, even though some people can do okay with that.
Yeah.
And I think we're able to do that easier when we're young because our hormones are like we have tons of testosterone, we have tons of growth hormone, and sometimes we work ourselves out to exhaustion and we're just going to fall asleep after. I remember working out at night and then come go to bed and I'm just exhausted and go to sleep. But as you get older, so what happens is you do work out, you have this stress response and cortisol. Well, you have an inverse relationship with melatonin levels and cortisol levels. So if you're spiking your cortisol, it's trashing your melatonin levels, and then you end up having that difficulty through your night sleep cycles.
Interesting.
And then as your cortisol levels are dropping, then your melatonin levels are conversely going the opposite. So in the morning, when you should have good cortisol levels, they're sort of thrashed. And then people go to bed late and then they sleep past their morning sunlight. And then they miss that sort of circadian rhythm of, having those cortisol spikes in the morning. So it really could get everything kind of like off track there as well. Plus you have to look at the insulin response, as far as they work out, they go eat. Well, insulin also has an inverse response on growth hormone release in the body, which that is recovery and that helps sleep. So they go home, they eat before bed, trashes their growth hormone levels. And when you have your first, the third stage of non-REM, that's the 80% of all your growth hormone release in the whole body in the whole day. So that's really impeding your recovery and your ability to go to sleep. Intriguing. So it's a really crazy different thing. So I'm a big fan of working out in the morning. Okay. And that doesn't have to be first thing in the morning. Yeah, it should be. It should be, at a good level if you're getting your morning sunlight, no glasses, and get up through your day and sort of get that rush, sort of hit that wave. It's like the best, in my opinion. And then you have these fluctuations through the day. Right. We call it the cortisol response curve. And so that's sort of like what we measure when we do more elaborate cortisol testing and melatonin.
Interesting.
Curves, yeah.
Where do you feel like, in terms of training, where do you feel like that line is to be drawn to where you're stressing yourself out more than it's worth? Obviously, I mentioned CrossFit. How is someone at home that may not have the access to your testing, right? Mm-hmm. How would someone at home draw the line in the sand of allow your body to rest more, or hey, the CrossFit for me 4 days a week is too much from a cortisol and a stress and a hormonal perspective? What are your thoughts on that? Yeah, so mind you, I'm not a personal trainer, but sure. I know the physiology. I'm not done with this kind of stuff. So I'm a big fan of, deferring that off to all my trainers that are my peers, where I'm at. But in general, I think that people overestimate how much they need to work out in order to get results. I think that's a huge. I would agree. So they definitely overestimate. People that haven't worked out for years and they think they need to go just kill it and this and that. We're really just very fundamental. If you're not doing anything, you'd be blown away at what working out 3 times a week would be for 30, 40 minutes. Yeah. You don't have to do all these sets. And all this work, and you don't even have to work out to failure. You don't have to make it till every set you don't go anymore. You can, and there's a lot of really good. There's a whole RPE system where, there's a million different types of working out. This is a whole soapbox. Right. But I think that the maturity of what your training level is going to be a big indicator. So you're going to be able to push yourself a lot harder if you've been working out every day or, multiple times a week for 3 decades, right, versus somebody that hasn't worked out or even has had a big break. Even when I've had periods of my life where I'm not able to train for a couple of years what I want to do. Sure. But when I get back into it, I don't just go full blown. Yeah. Full blown. You get in trouble with that. You don't need much. You really don't. Yeah. And to sort of utilize that until you start to see plateaus in your results. And then that's when you can start kicking it up and start adding things. And that's why I think the guidance of personal trainers, that's where that really comes in, because that's what they do every day. And they see those. And that's they can, if you have a good, experienced, knowledgeable personal trainer, those are the people that you really should be going to. What do you think of all the wearables nowadays? The Whoops, the rings, the R rings, that is. Yeah. You mentioned that you're looking at heart rate variability, you're looking at, all these kind of metrics. Are you ever leaning towards their data they're collecting outside the office and analyzing that?
Oh, 100%. So like, it's really cool. The system that we have for our metabolic testing is really neat because it gives you a full blown app. So not only does it personalize and utilize a whole team of registered dietitians to build out full blown meal plans that, are suited to your goals, but you can integrate in your Whoop or your Apple Play Watch or your Garmin or your anything, so that I can track your sleep, your heart rate variability, even the VO2 max that's on your watch. Now, a lot of this stuff is not going to be like getting the VO2 max on your watch. It can be pretty close. It's not like going and getting the testing done, no. But what you can do is you can develop trends. And I think trends are like super important. Like people ask me, well, what's the best way to get like your body composition tested? Do you go, do you get the like in-body scan, a scale work do, or can you get, what's the name of I'm blanking for the testing that's really big for body comp where they go sit the machine.
Like a bod pod you're talking?
No, this is embarrassing. I forgot the name of it. But DEXA scan. Jeez.
Oh, a DEXA.
Yeah,
okay.
DEXA
I was
scan.
thinking more like...
Yeah, so which is basically kind of like a little mini MRI that shows up like your body comp and stuff like that. I've seen errors in all of them. Yeah. Variable, but I think that they're all good tools if like you use the same one
and get
and then just get trends. Yeah. Cool. So just like even like when we do our macros and stuff like that, people on diet macros, like there's a lot of variability, even the nutritional contents of all the food they eat.
For sure.
So when you're going and you're tracking those, it's not really like 100% spot on.
Right.
But the important part is if you do it the same way all the time, you develop trends off there and you do that, then you can make your adjustment based off those trends, and that's where it really comes. So I think that, going back to your question, like using this, I think it's amazing. I love gathering data. I've seen some really cool rings coming out now. They're way beyond like the Oura ring. I've seen a couple of them. They're really high dollar, but like they don't even need a battery anymore because they use your body temperature for they track everything. Like it's just like that's so cool. I just don't have $5,000 to spend on something like that yet. But a lot of data.
Knowledge is power.
Yeah.
All right. What's one red flag symptom that people walk into your office with? They don't think it's a big deal, but you're like, man, we need to get this handled. This is part of your problem. What's one thing that people are unaware of? Maybe.
I think it's silly, but skin problems.
Interesting.
Yeah, so the
largest.
There's not the largest. it's a tough one. But skin problems, I think, is a big one, and gut problems. But skin, I really I link that to gut in a sense. It's kind of funny, but like when you think of like psoriasis, eczema, different skin issues, dryness, acne, a lot of that stuff is largely related to poor gut. And so I always ask those because that's one of the biggest things that people don't really correlate to. Right. Like, oh, that could be hormonal, that could be gut, that could be autoimmune. And so that's one of the big sort of red flags for me, to be honest with you.
I love it. Mm-hmm. You obviously do a lot with hormones. Mm-hmm. Most people, when they hear hormone, they're thinking testosterone. Mm-hmm. Is testosterone is it the master of all? What else are we missing?
Yeah, and so when people think hormones, when they hear hormone replacement, they think testosterone because it's been really popularized. Sure. So they HRT, TRT, so they call it TRT more than anything, but it should be HRT. But thyroid, testosterone, estrogen, progesterone would be like your sex hormones per se. Growth hormone levels are probably all the biggest ones per se, and they all sort of work in unison. Even though there's almost 100 hormones in the body. No, for sure. But those are the biggest ones, per se.
When you approach hormone optimization for women versus men, how does the approach change?
Not a whole lot.
Really?
Not really.
I didn't expect you to say that.
Yeah, not really. Because some of the main variables might change a little bit, Mm-hmm. I think that sometimes women have, a few more sex hormones that are like important to them, but testosterone is like super important to women too. Yeah. Just as men. But also estrogen balance is also important to men too, just as it is women. Right. You can see thyroid issues with both. But there are definitely things that we look at for across the board,
Is there a cadence of people, nowadays we're dealing with people with a multi-system issues and things like that. They're probably coming to you for maybe one problem. It might be multiple systems. It might be a thyroid issue. It might be a a testosterone issue, might be autoimmune issue, maybe per se. What's the cadence of? Are you going to throw the whole, sound wall at them to begin, or are you going to?
As far as like hormone replacement?
Yeah, like how do you start the cadence of this?
Yeah, so we just do a comprehensive hormone panel, and we sort of look at all of them because they do all interconnect.
Yeah, that's kind of my question.
So it's important, yeah. So I mean, I'm not a huge fan of like the street. I'm not knocking anything, but there's some of these clinics they just low T clinic. That's great. They just treat testosterone, but there's so many things like their hormones messed up, the growth hormones messed up. If they have other things, and you don't treat those things, it's like putting jet fuel into like a Pinto. It's like testosterone is probably like one of the biggest. Like, ooh, I feel it.
Yeah.
Like your testosterone's low. That's a big deal. I mean, because we go through menopause and then we go through male menopause, which is not such a thing. But like when we go through this 30s and 40s, those are the main hormones that like really drop off is testosterone. And consequently, because testosterone is linked with estrogen in men, because you need testosterone to make estrogen as a man, that also gets affected. And then, same thing with women, estrogen. So they're the biggest deals. And since testosterone does really affects your sleep, affects your body's ability, people become depressed with low testosterone, they develop anxiety, helps with focus. So we hear brain fog, we hear changes in libido, we hear decrease in muscle mass, inability to burn fat. Those are like big game changers. That's like a big deal. So those are like probably the most glaring things that we see symptomology wise.
So obviously women have been experimenting or doctors have been experimenting with hormone replacement therapy on menopausal women forever.
Yeah.
It kind of went through a period where there were some doctors like, this is unsafe, could be contributing to breast cancer and things like that. How do we go about making that safe, or, what do you do nowadays in terms of protocol to make sure it's not a risk and it's mainly reward?
Yeah. So I think a lot of it's misinformation.
Really?
Is the biggest thing. Yeah. So the research just wasn't really sort of there. Okay. A lot was really based on like hearsay, and they hear one thing and then that's sort of like the story that goes without really ever doing their own. And then also looking at like how the studies sort of like evolve into that. So we hear like, oh, testosterone causes cancer. No, testosterone doesn't cause cancer. It doesn't cause it in men or women. Or testosterone causes heart disease. So it's like, no, well, how are we treating the testosterone? Heart disease is a great one. And so the American Society of Urologists and Endocrinology just came out this last year, just like really admitted like, oh yeah, low testosterone is going to make an increased risk of heart disease or this and that, and so having normal levels of testosterone will decrease your risks, with the exception if you have low estrogen and high testosterone, then there's a risk of heart disease.
What is killing everybody's testosterone?
It's age.
Okay.
Age and
environment
for sure.
Okay.
Yeah, environment for sure. Foods we eat, our lifestyle, things I call, we call them hormone disruptors, the plastic water bottles, lavenders, the different soaps that we have, the, antibiotics in the food that we eat, the pesticides, they disrupt the body's ability to break down those hormones.
What's like the biggest change that someone could do if they're like trying to experiment with this and like, is there one that you'd pick? This is the biggest one.
To change all of that, just be proactive with seeing somebody that can help guide you down that road. Because there's so many variables. So it's really talking to somebody that's knowledgeable and understanding, and to be able to work with you to develop a plan. The biggest change that you can make might be different than the biggest change somebody else can make.
Interesting.
So
you know what change I made when you came in here one time?
What?
You mentioned something about a lavender oil in one of my bathrooms.
Yeah.
You're like, man, it's killing your testosterone. I'm like, oh, is that what's happening to me?
Yeah, and don't. Yeah, so for the audience, don't take this the wrong way. So a lot of things what they're mixed with. So I made a mention to Dr. Brown here that certain things like lavender is like one of them. It's not like lavender out in the field is going to like cause you to have these, but how some of these different things are what they're mixed in, and some of the preservatives and especially soaps and things like that. That is the problem with a lot of these things, and those prevent the body's breakdown. of certain things. And
so would that be more of like a xenoestrogen,
in a
or is that
sense,
different?
yeah. So what happens is the body breaks down testosterone and estrogen into multiple types of estrogen. Okay. And so there's good estrogen and there's bad estrogen. I won't go too far on this, but this is a very important point. And so there's multiple types of estrogen. And so there's body breaks down estradiol and estrone. Well, estrone breaks down into 2, 14, and 16 methyl hydroxyestrone, and basically the 2 part is thought to be a healthy estrogen. Okay, that's supposed to prevent blood clots. It's supposed to prevent cancer, things like that. But the 4 type specifically, and even the 16 type, is thought to cause blood clots and to cause cancers. And so if you're not breaking down your estrogen appropriately, it will go down those 4 in the 16 route. And so some of these other things like plastic water bottles, smoking, these lavders and all this other stuff, it'll actually prevent the body from putting it down the healthy pathway, and it goes to past the least resistance, which is the unhealthy pathway. And that's why these people get some of these things. And so we check those different levels and make sure that they're sort of living a lifestyle where they're able to properly metabolize, so manage their estrogen versus just like wiping it out altogether.
How do you pick treatment plans in terms of what you use with hormones? You got pellets, you got creams, you've got injections. How do you plan that?
So the biggest thing is what's the healthiest way, and patient compliance. Lifestyle compliance and safety. Safety is always going to be first. So estrogen, if you're taking estrogen like an oral fashion, for example, the body's more prone to wanting to break it down into the unhealthy type of estrogen, almost 16 times more liable to break it down to the unhealthy versus taking estrogen in a way that bypasses the liver and goes directly into the bloodstream. So that would be like a cream, or that would be like a dissolvable tablet, or even an injection or a pellet. That's going to be more prone to going down the healthy pathway. So we sort of like try and pick those kind of ways and work with the patient. And then we also want something the patient's going to be able to be compliant on. And we're like, we're supposed to do this every day, but I'm only going to take it every once in a while. We want them to be able to build a plan that's going to be best for them.
How much does this plan change if someone's on like a hormonal birth control? Do you have to take that into consideration?
Yeah, but also to determine like what we're trying to give it to them. So if they're on birth control or for whatever they're doing, we definitely want to work with their, their GYN doctor, figure out why they're on it per se. But you also want to give them hormones that's going to completely wipe out the whole point of the birth control.
Right. That's my question.
Yes, for sure. So if you got something like blocking everything so that they're, trying to not ovulate, and then you just replace it, then you're just sort of like,
right,
I'm going to take the birth control out.
Yeah, exactly. Let's switch gears. We talked a lot about hormones. Let's get into, I think, what excites you and what patients ask me a lot about. We're talking peptides. We're talking PRP. We're talking stem cells. We're talking exosomes. Let's start with peptides. It's been a hot topic. The FDA liked it up front. Then they said, no, that's questionable on what the FDA really, what their skin in the game is and why they allow it or don't allow it. BPC, what is it? 157. 157 was the first one I heard about. I had a patient come in, was being treated for knee pain. We were doing laser, all kinds of stuff. Wasn't really helping him as much as we both liked. He came back raving about this. And I'll never forget, this was maybe 5-6 years ago. Came back and he's like, man, you got to check this out, this BPC 157. And I'm like, he was messing with me or something. I had no idea what this was. He's like, you got to check this out. It's great. I think he was like, I ordered online, injected in my knee or something like that. Like, this just sounds like crazy, right? And then I heard it a few more times, and everybody was, using it for this and that and this ailment. Like, man, I feel like I'm 25 again, all of that. So give us the rundown on peptides, their current usage, and what you recommend them for.
Yeah, so what is a peptide, I guess, for sure. That's a great starting point, because we hear peptides and we hear this, we're like, oh, it's something new. Now, we realize like peptides have been around for a long time. Our body even makes peptides. So insulin's a peptide, glucagon's a peptide, oxytocin's a peptide. These are all naturally occurring in our body. BPC 157 actually is made out of gastric juice. It occurs in your body. So does things like thymosin beta 4, thymosin alpha 1. Those are all peptides that are all made in our body. tirzepatide, semaglutide, those are also peptides that we make. And so a peptide is basically a sequence of amino acids that are linked together in a sequence to make the body create its own response. So between peptides, anywhere between 50 amino acids in a row, anywhere between 51 and 100, that's called a polypeptide. Above 100 is called a protein. So basically polypeptides are made from multiple peptides turn into a protein, that kind of thing. So when we hear about these healing peptides per se, they're basically they're medications that have started out through experimental this or that, and maybe didn't make it to current trials or didn't find a medical use for it, or maybe they're still even being studied. A lot of them are still being studied. Tesamorelin is a great example of a peptide, and sermorelin, we hear about those. Those are growth hormone peptides. They're also prescription drugs that are FDA approved. So tesamorelin actually goes by the trade name, or goes by the name of Agrifta. It's used for something called AIDS lipodystrophy. So AIDS patients get this little body wasting, they get a muscle wasting disease, and so they waste muscle, and they accumulate belly fat, visceral fat. This peptide increases your body mass, and it burns fat. So that's sort of like what peptides are and do per se. So where it's come into play is the availability of them, and where do you get them from, and the performance enhancing benefits of them. And so they've basically become available on, I guess you say, like illegal markets per se. So they are medications. So they do require a licensed provider to prescribe them. So when you hear of these places like online, I'm not going to say names, but Peptide Sciences or things like that, where you can go get these peptides.
Definitely not get sponsored for this podcast.
Yeah, I'm not looking for a sponsor for them either. So, but just like be straight, is like these are not pharmacies that are making these. They get raw product, which may be raw product, but they're put together in questionable environments. They don't have safety regulations. They're not getting tested for sterility and safety and potency. And lots of times what they're compounded in, so when you put these medications together and build them like you would in a pharmacy, what you build them in needs to be safe. And so they call them polysaccharides, or the different compounding agents that they actually put these medications together in. If they're not clean, or if they're made in certain ways, they can actually cause autoimmune responses in the body. They can cause inflammatory markers. They can cause you to like reject the medication. I mean, there's a lot of different things that come from that. And so that's the difference between getting them online, which is huge right now, and the FDA is going after those places big, or having actually built in a pharmacy by a licensed pharmacist who knows how to do this under a sterile hood and with high quality product.
Is that something that you send home with the patient to inject themselves, or is it like a one-time injection?
Yeah, so places that prescribe these, they get, lots of times they'll get either sent home from the pharmacy and to the client, and they'll self-administer these peptides under the instructions written by the provider.
Interesting.
Yeah. So they're fairly easy to do, just like you would insulin or testosterone or anything like that. I
had Dr. Anderson on the podcast. He's a anesthesiologist, pain management guy now, and he was saying, we were talking about this, and he was saying that back in the day when they would crack people's chests open to open heart surgery, they would, right when they're about ready to pack them back up, they would inject basically a ton of PRP, and I guess he was acting like sometimes they would do some experiments with peptides back in the day, and I found that intriguing, but even PRP was interesting to me to hear that they were doing that back in the day. But
yeah, PRP has been around quite a while, actually.
Yeah. So how does that compare to something like stem cells?
So stem cells is going to be a regenerative type thing, and so it's very similar in a sense.
Do you get regeneration with the peptides?
You can. Yeah, just a different way.
Okay.
Just in a different way. So your body is, heals under a variety of different mechanisms. Okay. So, the body has a lot of healing, different responses that occurs. It could be from thyroid tissue, gastric juice, growth hormone can stimulate, healing, good testosterone, a lot of these things that can promote healing in a variety of different ways, even different other amino acids, proteins. That's why we ensure protein intake. I mean, the body's amazing at multiple things. And so the the theory behind stem cells is the body has its own stem cells that regenerate itself all the time. So we have stem cells. As we get older, our stem cell levels decrease.
At what point is that?
The day we're born.
Really?
Yeah, I mean, I think that probably the most beneficial stem cells come out of a newborn. They literally build new humans.
Is there an age where they're like so low where it's not really viable anymore, or is it?
I think it has to do with your own health.
Is it?
Yeah, I mean, you have somebody, we call that in a sense like epigenetics, which is your body's own personal genetic transformation based on the environment that you provide for itself. So if you're somebody that's like not taking care of itself and have insulin resistance and you've smoked and cardiac, disease, and, you're not going to have, none of your cells are going to recover as well if you have a low VO2 max.
Right.
So the healthier you are, but also as you age, so when you're starting to get, like late 20s, 30s, 40s, your stem cell levels are going to be dropping in numbers and quality. And so getting stem cells, from an outside source is making sure you not only get healthy stem cells, so you can get stem cells from yourself. A lot of people will go to get stem cells, and they'll pull them from bone marrow. You can pull them from fat. You can pull them from a variety of different. You can get it from placental tissue. You can get it from amniotic fluid.
What's the best?
I'm the biggest fan of what we call mesenchymal stem cells that come from umbilical cords.
Okay.
Yeah, that's my biggest fan of that. And that's not the best for all. There are, like placental tissue can be really good for like eye stuff. And, it really depends on, there's other, for like, if you're like really trying to like regrow bone, there's different, right? But as a general whole, like if you're trying to like do something to repair the body, stem cells from umbilical cord of a healthy, birth is going to be the best.
So are they harvesting that? Are these hospitals selling these when they have them?
Hopefully it's the patients per se, but yeah, it's just basically patients that sign up. They know they're having a baby. There's a scheduled C-sections, and lots of times the patient, the parent, is also simultaneously maybe trying to save them in case something goes wrong with the baby later on in life, and they develop like a leukemia or some kind of cancer, so that they have healthy stem cells that the baby could give themselves.
Or can you like freeze them?
And they do. Yeah, they freeze them.
Okay.
Yeah. So then there's leftover, or maybe they've just been approached by some of these people for research studies and say, hey, you willing to sell these and, or donate or whatever. And that's where they come from.
So
they're stored in like tissue banks, credited tissue banks. With
your clients and patients, where are the stem cells coming from? Because that's obviously a big ticking point. Patients always ask me like, this is a big investment. Like, why is it so expensive? And I was always taught and educated that it was kind of the way that you get stem cells, and it's, supply and demand, right? It's not like you can get them from everywhere.
Well, there's a lot involved, not just there's many processes, and they subcomponent them down, so they'll take that umbilical cord or that, and they'll divide them out into different types of stem cells and wort and jelly and mesenchymal cells alone and exosomes and into, multi-components, and sort of like fraction them off, because depending on what kind of procedure, what kind of use you're going to have for them would be the application that you need. And then so those need to be packaged. They need to have a certain amount of those be taken out, actually be tested, and make sure that they're good quality. And so there's quality control. And then, then you got to pay for every step along the way. So it's not necessarily a cheap process. And then you're also paying for the knowledge of the provider putting it, making the correct choices, and they're not FDA approved for any specific disease in the United States. There's trials going on, but, there's things that we hypothetically think that they could help with and that we've seen results on. And so that's kind of the avenue is like, hey, we've seen now that for a while, a lot of people, they get stem cells, they're great results. And the clients make a decision of, hey, I've failed in these other avenues, and I've had friends that have done this. The research is there; it makes sense, and this is something we'd like to try.
Is there any evidence that it can regenerate intervertebral discs at all?
So, there's evidence. What level of evidence?
Have you had any
different
anecdotal?
Yeah, I have a number of friends that, that's not something we do specifically in my practice. And I have a number of colleagues that I refer that stuff out to because we like to stay in our own wheelhouse of that. So we do everything in my clinic but spine. And so we do a lot of musculoskeletal stuff like that. But I have a few providers that are very close to me that I'm very highly trusted of that I send those people to, and they have very good results, yes.
And are stem cells going directly into the area you're trying to treat, or is it more systemic treatment?
It depends. And so most of the time the stem cells kind of have to go where you're putting it at. On the flip side, we have things like exosomes, okay, which are able to transfuse into areas that stem cells won't go into because they're so small. So every cell in the body has what we call intracellular vesicles, where basically they're called exosomes, and they make more stem cells. And so, in essence, like a general, we're talking big difference in size. And so those exosomes can actually go places that the stem cells can't because the stem cells are too big. But when the exosomes go into that place, then they can generate and make more stem cells inside. So they can cross over in through to like the blood-brain barrier, into vascular stuff, and they make more stem cells, and they can regenerate into places where we could technically kind of like inject it in there.
And is that the same process of harvesting exosomes? You get them from the same spot?
Same spot, yeah.
Is there less of them because they're the precursor?
No, there's way more.
Way more?
Way more, yeah. So like, for example, like a vial that might have 3 milliliters of stem cells might have anywhere between 10, 20, 30 billion, or 10, 20 million stem cells. You may get 200, 300 billion exosomes.
Are they splitting that, or you're getting that when you get stem cells?
Explain it again.
So meaning like you go in for I feel like you've told me you do exosomes and stem cells.
Yeah, so you get them in separate. Yeah, you get them separate. If you want them both, you want them together, then you typically just mix them together.
What would you recommend? Do both?
It depends on what it is.
Okay.
Yeah. So, for example, like if it's going to be more bony or more of a joint, things like that, you want something more like a stem cell that's going to sort of like latch into that process. Where you've got more like a cartilaginous area or a fibrous area or ligament, then exosomes might benefit that as well because they'll be able to diffuse into that.
Yeah.
And so sometimes you mix both.
Interesting.
Yeah.
Okay.
Yeah.
Now you hear about
there's also a cost point too. And so, obviously, like, there's almost hardly ever going to like hurt to throw exosomes in, but exosomes definitely cost more money.
They cost more money.
Yeah, for sure.
So if someone's going to Cancun and doing these medical trips where you're getting stem cells and whatever, Turkey's a big one now to get hair transplant.
Yeah.
I don't know if you've checked it. No, I'm joking.
Yeah, I know. I give them I don't want my hair.
Have you seen the pictures of people on the airplanes going to and from Turkey from the United States? Yeah. And it's just like a camera of all the seats, a picture of all the seats, and it's
everybody's
like
out there.
Eight guys, they all have the classic like.
They're very good over there.
Why is it so inexpensive there? Because I've heard some quotes.
I've heard some great. Yeah, I've got a lot of friends and a lot of clients that have gone over there. Have been very impressed. I haven't heard a bad thing. They go over there and they get a lot of stuff. And I don't know if it's the volume that they do over there. They're just so good at it.
I've seen some. I've heard some price comparisons where it's like $30,000 here and like $2,500 there.
For sure.
Like it's 10% of the price.
Yeah. And I don't know the business side of it. I imagine volume. I imagine the cost of things over there. There's a lot of overhead costs here that go into.
May not exist there.
Yeah. And so I don't want to speak for the business aspect of it, but yeah, I've heard a lot of really good things, a lot of good experiences.
With that
They're
being
very
said,
good at what they do. Yeah.
People are going to Turkey for hair, but should they go to Colombia for stem cells?
They can. There's some very good places down, like Costa Rica.
Is that trustworthy and reputable? Obviously,
every place is different. Every place is different. Yeah. So there's a lot of really good clinics over there, and so. But I think the big thing too is, it used to be that's the only place you could get them.
Okay.
That's the big thing, is that only place you could get them and good stuff. And now we could actually get more good stuff, and it's becoming a little more available here in the United States. So that's kind of the thing. And what they're able to do in other countries too that we can't do here is clone stem cells. So what they'll do is like they'll take some of this good stem cells that we have and they'll put it in a petri dish and like literally grow them in their office, and they can grow them, and make more and more and more, so they can get high volume. So you'll hear be like, oh yeah, I got 500 billion exosomes, or 50 million stem cells.
Is the efficacy as good if it's not as potent, if they're cloning stem cells versus?
Yes. So every time you clone it, the effectiveness is not quite as good. It'd be this is a horrible example. It'd be like making a new me, but then the new me doesn't have like a nose or, doesn't have an ear or something like that.
Right.
Like it's still
There's
work.
room for error.
But yeah, there's room
May
for
not be
that
as
kind of
effective.
thing. And there is some things that actually will benefit from just, even if they're not all perfect, the part that they need is great. And so that volume, there's certain neurological things and stuff like that. And that actually will benefit from high volumes regardless. And so, but, quality does trump quantity in most cases.
What kind of things are you seeing that stem cells are the best for, where others you might go for more of a PRP or a peptide? And I know that the last time I did the podcast, you were kind of like, let's cocktail everything. Is there some things that stem cells work really well for and some things that peptides really work well for and PRP and et cetera? Yeah,
I think some of the bigger things, I mean, you're not going to most of the time like heal like a partial rotator cuff tear or something like that with peptides, depending. I think there's certain things that are bigger that you're going to be able to, maybe you could get away without surgery. And in our practice, we always have a surgical consult involved for certain things that come with that. So it's like, hey, is this something that we could get away with? There has to be enough to heal. So, but there's some of those things that are bigger, like in the big between range that, hey, the stem cells definitely, you're going to need stem cells. But then also, like, hey, stem cells will work, but you're probably going to see even results faster with stem cells and peptides per se.
I love it.
So, for example, like, I shared with this guy, tore my pec completely. Like, and I'm going to make a video about this here pretty soon, but I had a complete pectoral tear about 10 weeks post-op right now. And
how has that changed you? What treatment have you done to it, and what have you noticed?
Yeah, so it's healed up pretty dang good. It's so I've done about 4 different peptides, a few other. I'm not going to give away all my recipe right now, but it's healing very, very, very well, very quickly.
Now, here's a better question:
Yeah.
Did you tell your doctor that you were doing this?
She's going to listen to this podcast. Yeah, it won't be secret, but I did want more of an objective. I think he knows what I do,
Sure.
but we didn't really.
I was curious if you were going to get the response of like, Glenn, this is like top 10% of healing here. What are you doing? Or if it was like, if there was a comment of that or anything.
Yeah, no. So I just sort of kept down, and because I just don't want to put anybody out your liability. My surgeon is an exceptional surgeon. I'm very happy with. I mean, I think that the surgery went great, and he's just an amazing surgeon, to be honest with you. But that's not an area that he specializes in, the area that I do, and just likewise, I'm not a surgeon either. But yeah.
What are you excited for in the future, man? You're like at the forefront of cutting edge healing treatments. What are you doing now that's new? What are you excited for in the future?
I'm excited about arm wrestling.
Wow. Are you going to get into arm wrestling?
I'm learning. Yeah, I am. And
Did you go up against Philip?
What's that? No way, man. He's a whole different level. So, but yeah, no, we sponsored the Texas Arm Wrestling League, the Arizona Arm Wrestling League, and arm wrestling. And now we're one of the top sponsors of East versus West, which is one of the biggest arm wrestling promotions in the world. And that's where I'm going this weekend. They're having East versus West 20 in Switzerland, and so yeah, I'm a huge advocate of the sport, and it's just such a great, cool, growing sport. People are like, "You kidding me?" But it's really kind of like one of the things that we enjoy as a company too, is building that relationship.
That's awesome, man.
Yeah.
And you sent me a client of yours this past week that was in Sweden.
Yeah, he's
top 10 in the world.
Yeah, he's.
So he told me something that was interesting, right? So I'm working on him, and he says, I said, what % of arm wrestling is strength versus technique versus willpower, right? And he said it was 60% technique. Mm-hmm. And he said, I'll tell you a story in his Swedish accent. I won't try to, his Viking Swedish accent, I won't try to mimic that. But he said, the first time I ever arm wrestled, and this guy, I mean, he's 6'6", 375. Mm-hmm. The first guy that he'd ever arm wrestled was 178 pounds. Mm-hmm. Took him down. He said, he didn't even know what happened.
Yeah.
I'm 178 pounds.
Yeah.
And I'm looking at my arm versus his arm.
Yeah.
And I'm going, how? Mm-hmm. He's like, man, if you just know what you're doing, you got the right technique, you got the right brain to muscle, the ability. Right? Yeah. That was intriguing to me. So you're into arm wrestling.
It's fun. Yeah.
You actually do it, or you just sponsor with the company?
I try. Let's put it that way. So I try to arm wrestle. I mean, there's definitely levels to this. Like, I'm learning. It's really cool. Texas is really kind of cool. So, the president of the Texas Arm Wrestling League, Billy Tegas, is just an amazing guy. He's a stud. He's just,
Really?
yeah. In the community, I love the community. I really do. So there's a couple of arm wrestling clubs around here, and I go to, we go to them and go to the practices when I can. Haven't the last couple of months because of this, but everybody's just so wants to teach and and help you grow, and it's just such a cool thing. My son's 13; he's getting involved in it.
Really?
Yeah. There's a lot of technique involved. I mean, there's been people that have been in this forever. It's really kind of cool. It's kind of a really cool deal.
So you're into arm wrestling. Give us a nugget. What is your business doing new that you're excited about and is helping a lot of people?
Just in general?
Yeah.
Yeah. I think, the metabolic testing is one of the newest things that is on board, really putting together that whole package with that,
I love it.
And so
how much does AI influence testing and decision making and all that for you?
It's kind of funny you say that, because our whole intake platform for a medical record is based on AI. Really cool physician around here, runs a functional medicine practice, or developed this program. And so the intake questionnaire for it is all based on AI. Ask questions, then basically if you, it's like, oh, my sleep's poor, then it'll ask you a couple more questions. And so it actually has a AI-based health score that it comes up for you, about 20 different areas of health, objectives, whether it's, sleep, anxiety, depression, cardiac risk is all a good baseline. So when you come in, you complete your assessment, AI sort of comes up with that. So we take our own assessment, we take that tool, we take all our lab data, we take our metabolic testing, and we form a plan of care from that while working with the client's trainer if they're working with a trainer.
I would imagine it would just hone in your testing, save you time, save the patient's money, get you to your end result quicker is what I would assume. I don't know. I mean,
it's very good. AI's come a long way. It's not all there yet. I mean, it's just not as simple. I have a lot of friends. I mean, we have a lot of clients now. They'll get their lab results ahead of time, and they'll drag their lab results into chat. And
you were one of the. Is that any good, by the way? Is chat pretty good at reading lab results?
Not bad. They're not bad, but I wouldn't trust. And that's the thing, is because there's chat's going to look at the normal lab ranges per se, and people need to really understand where lab value ranges come from, for one. And so, and then it'll give lab ranges come. So if you go get your labs drawn, for example, what it does is it's going to take a radius of where you get your labs drawn for the most part, and it takes just basically an average, and then of the clients that go their labs drawn, every age, every within that dynamic, and then a couple standard deviations out from that. So if you have a population that is chronically undertreated in a certain area, that abnormal range becomes a new range.
Interesting.
So
I was going to say, if you take one trip to the state fair, you realize you probably don't want to be the average of what's around you.
For sure.
But anyways, go ahead. Sorry.
Yeah. So that's sort of the thing. And so we don't basically some of the tests that we do, it's not based on the lab ranges, it's based on what evidence shows. So we want to know, what does evidence show? What's a normal? Not what within this range that the general population seems to sort of fit in, but where should your level be to be healthy? I've
always distrusted those ranges, and I don't do blood work, and I learned about it in school. I don't do it, but I've always distrusted it because, does it take into account male? I'm talking about the CBC or something. Does it take into account male or female? How old you are? How healthy you are? It's
a lot of those it does, but it also doesn't tell you how to utilize it. So so this is a great example. I'm just going to take just these B12 level.
Okay.
Yeah, B12. So when you get your blood drawn in a lab and you get what's called a serum B12, so you got to imagine there's a pipe, and in that pipe you got fluid, but then you have all the cells, right? Okay, which are going around. And so when you're doing a serum, it's pulling the water out, but not inside the cells. But we want to know what's inside the cells. So, but that doesn't tell you that. So it gives you sort of a range. So, but if you want to know what your body's actually utilizing as a B12 level, you really need a urine test, which is going to show your metabolites of B12 is how it's been utilized. Or, for example, a methylmalonic acid level, which is actually how B12, it breaks down, and you want that from a certain level. So the serum level is just an estimate of what would be, but it doesn't show you what you're using in the cell.
Interesting.
But that's what everybody tests is B12, serum B12.
Yeah.
So if you go get a diagnosis of, low B12, your B12 could be fine. Or you could have a normal B12 level, and you could actually have very low intracellular levels of B12. And they won't treat you because they don't know.
It's complex.
It's super complex.
And I think that sometimes, the doctors ordering these don't always know how to interpret them. They're kind of going off the ranges. And like I said, it's not my specialty, but a fair amount of people come in and they're, everything's normal, but I'm still feeling this way. And I can only help but think you're not testing the right things, or you're not looking at the right ranges, or somebody's not putting together the pieces correctly.
Or just not doing the right tests.
Yeah. Yeah. Glenn, it's fantastic talking to you.
Thanks for having me
Tell the
on.
people where they can find you, where they can utilize your services.
Yeah, Instagram is Infinity Functional Performance. Get us on there.
I love it, man.
IFP.life is our website.
Great.
Thank you again.
Glenn is your one-stop shop for optimizing. He treats a lot of
Soccer moms to elite athletes.
elite athletes. Yeah, I would say that most of the people that you've sent me have been,
Yeah, we have a lot of really
athletes.
good providers in our practice. We got a really good team.
I love it.
And, I might not be the one, but one of our team members will take care of you.
Yeah.
And so we got a great.
Fantastic, man. Thank you for coming on. Appreciate your time.
All right. Thank you.